One of our budget submissions to state government this year is to address loneliness and social isolation while improving physical and mental health outcomes by advancing social prescribing initiatives through Neighbourhood Centres in Queensland. There are currently 13 short-term funded social prescribing programs in Neighbourhood Centres. We're here at Mt Gravatt Community Centre to find out about their Ways to Wellness program, which was the very first one to be funded.
We were one of the first social prescribing programs within Southeast Queensland, so we've been running for 7 years.
What we see when people present is that they're not looking for one-off solutions. When they present to us, what they're looking for is connections and supports that will help them build capacity and capability over time.
What we do is essentially help people who might be socially isolated, they might be lonely, they may even just be new to the area, to have a conversation with them about what matters to them. So when you think about, there's a really interesting literature review that finds that 10% of patients take up 30 to 50% of GP appointment times, and that's generally due to unmet needs like social isolation and loneliness. GPs are inundated at the moment. They do not have the time to be able to have that conversation with patients. So generally how things work is a patient may say to the GP, I'm lonely, I'm socially isolated. The GP will refer that patient to a link worker, which is my role.
So the link worker role is really pivotal to the programs that we support. It's not just a referral point, it's a really relational person who sits and gives that really centralised support to the individual. And essentially what the link worker does is they walk alongside that person as they reconnect back into services and community again.
I guess social prescribing is a fabulous tool when you think about health. It isn't just the absence of illness, it is our social, it's our physical, and it's our mental health. And the benefits are profound. When you think about it, 1 in 3 Australians are lonely, which is massive, and 1 in 6 Australians are chronically lonely. And the risk factor for loneliness is huge. You're twice as more likely to have chronic disease, you're almost 5 times more likely to be depressed, you're 4 times more likely to be socially anxious.
By investing in neighbourhood centres as the backbone of a social prescribing system, we can ensure place-based responses to local needs and strengths.